Health monitoring behavioral factors. In addition to personal and environmental factors, behavioral factors also influence your health. Furthermore, behavioral factors are largely within your control. You can choose what to eat and how much exercise to do, for example. And so you can actively choose to improve your health. A healthy diet can reduce your risk of obesity and of certain diseases such as diabetes. Eating plenty of vegetables, fruit, and fiber, using unsaturated fats, and eating low fat protein can maximize your health. Regular exercise improves the quality of life, enhances mental well being, and increases life expectancy. To benefit your health every week, aim to do at least 150 minutes of exercise that raises your heart rate. If you smoke, stopping is probably the most important thing you can do to improve your health. It is never too late to stop, but the sooner you stop, the greater the reduction in your risk of smoking related diseases. It is important to take medication only as advised by a healthcare professional. Recreational drug use can severely damage physical and mental health and can be fatal. It can also affect relationships and work life. Excessive alcohol use can seriously damage your health, and the more you drink, the greater the health risk. However, drinking a small amount may help to protect against heart disease and stroke. Most adults need 7 to 9 hours of sleep at a night. Good sleep improves concentration, motivation, and mood. Exercise, reducing the time using a computer, and cutting down alcohol intake can help to improve sleep. Your lifestyle can have a large impact on your health. To some extent, lifestyle behaviors are influenced by your family and peers. For example, if they generally follow a healthy lifestyle, such as exercising regularly and not smoking or using recreational drugs, you are likely to do the same. However, ultimately, it is your personal choice about which lifestyle behaviors to adopt. Good quality relationships with family, friends, and the community in which you live are important for both your physical and mental well being, helping you to have a longer, happier life with fewer mental health issues. An active social life and engaging in leisure activities can help reduce stress and improve physical and mental well being. Social isolation is linked with higher rates of illness and decreased life satisfaction. Safer sex methods reduce your risk of catching a sexually transmitted infection. For heterosexual sex, they also reduce the likelihood of an unwanted pregnancy. The fewer partners you have, the lower the risk of catching an STI. A good quality job with adequate pay, protection from physical hazards, job security, and job satisfaction is associated with a higher level of both physical and psychological well being. In the short term, a certain amount of stress can be positive because it can help motivate you. However, long term stress can damage your physical health and cause anxiety and depression. For reasons that are not entirely clear, people with higher incomes are generally less at risk from mental illness, harm from drugs, alcohol, or smoking, and from emotional issues. Thank you for your attention.
Let's discuss interviewing pensiveness. Pensiveness is very similar to worry in its character and effect. It consists in brooding, constantly thinking about certain events or people, even though not worrying. Nostalgic, bunkering after the past, and generally thinking intensely about life rather than living it. In extreme cases, pensiveness leads to obsessive thoughts. In a different sense, pensiveness also includes excessive mental work in the process of one's work or study. Pensiveness affects the spleen and, like worry, it nuts chi. It will therefore cause symptoms similar to those outlined above. The only difference will be that the pulse of the right side not only will feel slightly tight, but will have no wave. One can feel the normal pulse as a wave under the fingers moving from the rear towards the front position. The pulse without wave lacks this flowing movement from rear to front position, and instead it felt as if each individual position were separated from the others. In the case of pensiveness, the pulse will lack a wave only on the right middle position. A pulse without a wave in the front and middle position indicates sadness. So we have here the choppy pulse quality in relation to a wave. Pensiveness, it affects the spleen and heart. It knocks chi. In severe cases, it leads to obsessive thoughts. Pensiveness also includes excessive mental work. Thank you for your attention.
Let's talk about the foot yang ming or stomach meridian. The foot yang min or stomach meridian starts on the depression in the midline of the lower eyelid as seen in this illustration. Stomach 1 means receive tears, containing tears, tear container, brimming tears, face bone hole, mouse hole, or ravine hole. It's the entry point, the point of the Yang Chao Mai, crossing point with Ren Mai. The stomach is a sea of liquids and cereals. It is a storehouse which receives everything we ingest, whether it is food, drink, information, or atmospheres. Stomach and spleen work together more closely than any other partnership among the officials. Together, they command the movements of lowering and raising up. The stomach likes to be cool and wet. The spleen likes to be dry and warm. As the two earth officials, they reside in the middle jiao, in the center of the body, and are the place of transformation, the place of humanity between heaven and earth. As the entry point on the stomach meridian, located in the heavenly part of the body, received tears starts the journey of processing and digesting. That is the role of the stomach. The stomach governs our ability to take in, process, retain from what we perceive, and both nourish and be nourished by the storage and processing of food and chi. The stomach is the official who rots and ripens, but before using what has been transformed, whether food, chi, or thoughts, we have to be able to receive. Earth, our center, is a place of exchange, of receiving and processing within. When healthy, we know where our center is. We can reach from our center out towards the periphery, welcome mutually sustaining contact with others, and we can draw back to our center as appropriate. Often, when Earth becomes imbalanced, its flexibility is lost, and there is either an inability to relax and receive nourishment for oneself, shown in a continual attempt to nourish others rather than attend to oneself, or conversely, a lack of understanding for others as our own needs swallow all our attention. One person can display all these tendencies at different times. There's only a problem when it is inappropriate. Often they are accompanied by overthinking. Thought is under the domain of the earth element, and often when earth is imbalanced, the usual processing and mixing that allows thoughts to arise and take shape can go awry, and thought, instead of proceeding smoothly, becomes obsessional or circular. Until the stomach stops over processing in this way, the spleen cannot begin to transform thought into action and form. Stomach and spleen are the origin of post-heaven chi. If the stomach is deficient, there will be insufficient chi produced, and the person may complain of exhaustion. Received tears can be a great point to move the chi. If someone has been stuck nursing some old hurt or unable to stop chewing the cud, mentally, this point in the heavenly aspect of the body, right near the sense organ of the eye, can help them acknowledge their distress, but then move on, allowing in some new information, a new view, and renewed vitality. Tears refers to the depression of the point location which can catch tears, but also reminds us of the importance of liquids in the role of the stomach, the origin of fluids. which improves secretion as well as helps to balance lacrimation. Stomach 1 is a major point for eye disorders. It expels wind through its connection with the yang chow mai, and so it can also be used for eye problems from exterior wind heat or wind cold, swelling, pain, lacrimation, and paralysis of the eyelid, as well as interior wind problems such as tic. Stomach 1, 3, and 4 are all coalescent, coalescent points of the yang chow mai, which has an effect on the eyes. Yin and yang chow mai meet at the eyes and allows the eyes to stay moist as well as regulating opening and closing the eyes. The pathway between LI20 and stomach 1 also passes through bladder 1. Brightens the eyes, bringing all the richness and tonifying ability of yang ming, blood and qi to the area of the eye. The indications, if we have eye problems, tearing, tic, it's also used for acute and chronic conjunctivitis, myopia, astigmatism, squint, color and night blindness, atrophy of the optic nerve, early stages of cataract or glaucoma, keratitis, retinitis, and optic neuritis. This is the start of the meridian, which is concerned with receiving and digesting things, food, drink, information, feelings. This point can help a person move on in their life if they are stuck mentally or emotionally, particularly with overthinking. For eye disorders such as conjunctivitis, myopia, the early stages of cataracts, or glaucoma. Thank you for your attention.
Let's discuss bladder pattern, damp heat in the bladder. Concept: this pattern is ascribed to invasion of damp heat in the bladder. Damp heat impairs the function of the bladder. According to the Sanjiao pattern differentiation, it belongs to the lower jaw. The clinical manifestation: there is frequent and urgent urination, distending pain in lower abdomen, burning pain on urination, scanty dark yellow urine, or turbid or cloudy urine. Hematuria: there is presence of blood in the urine, stones in the urine, fever, distension, and pain of the lumbar region, red tongue, yellow and sticky tongue coating, a slippery and rapid pulse. Key symptoms: there is frequent and urgent urination, burning pain on urination, stones or blood in the urine. Analysis: this pattern may be due to exogenous pathogenic factors or overeating and drinking without control, generating internal damp heat, both of which can cause damp heat brewing and binding in the bladder and lead to abnormal function of bladder qi transformation. So we have here the analysis of bladder damp heat. First, there is failure to transform qi. Abnormal bladder qi transformation, there results to frequent and urgent urination, burning on urination, dark yellow urine. If there's damp heat that evaporates body fluids after a long time, it develops to a stone in the urine. Under bladder damp heat, if there is damp heat in the bladder, there could be damp heat that endures fluid, resulting to a scanty urine. Damp heat damages the blood network, results to blood in the urine. If there's heat, steams, dampness, there is fever. Damp heat damages kidney, there is back pain. There's red tongue, yellow and sticky tongue coating, a slippery and rapid pulse. Identification: these patterns of bladder damp heat and excessive heat in the small intestine pattern have common symptoms such as frequent and urgent urination and burning on urination. However, the latter is due to heart fire moving downward to the small intestine and includes heart fixation, thirst, insomnia, and ulcers in the mouth and on the tongue. While the former pattern is caused by bladder damp heat accompanied by kidney disease manifestations such as fever, soreness of the lumbar region, etc. Because the kidney is related to the bladder in both the interior and the exterior and by the channels and collaterals. For the summary of damp heat in the bladder, the etiology, there is excessive exposure to exterior damp heat or dampness or cold emotional strain. Underlying or accompanying pathology, there is dampness and heat in the bladder. Possible presenting conditions, urinary tract infection or urinary calculus. Signs and symptoms, frequent and urgent urination, burning urination, difficult urination, dark yellow turbid urine, blood in the urine, fever, thirst with desire to drink, hypogastric fullness and pain, feeling hot, sand or stone in urine. Pulse, there is slippery, rapid, and wiry on the left rear position. The tongue is thick, sticky yellow coating on the root with red spots. Treatment principle, there is clear heat and disinhibit damp in the bladder. Free waterways, disinhibit water, and free lymph. Acupuncture treatments, we use spleen 9 for damp heat in the lower burner. Bladder 22 opens lower water passages. Stomach 28 regulates the bladder and urination. Bladder 28, dampness in the bladder. Spleen 6 for damp heat in the lower burner. Ren 3, front move point of bladder. Ren 9 resolves general dampness. Needle with drainage for small amount of red in the urine, we use DO 27. For pain in the urination, we use liver 5, liver 2. For blood in the urine, we use spleen 10 and bladder 60. Relevant advice when there is urinary bladder damp heat, the person should avoid foods and beverages that generate damp or heat. They should avoid exposure to climatic influences that can result in damp, heat, or cold invading the body. They should also avoid stress and situations that can result in emotional frustrations. Thank you for your attention.
Let's talk about pulse taking, abnormal rhythm, hesitant pulse, a choppy, rough, and sluggish, or semi. As a hesitant pulse. The hesitant pulse has an overall even or slow rate, but like the hurried pulse, there are irregular intervals without pulsation. The hurried and the hesitant pulses differ principally in their overall rates. The clinical significance, a hesitant pulse suggests such conditions as vigorous yin with stagnated qi, cold phlegm with blood stasis, and abnormal mass with food retention. It also suggests insufficiency and decline of the visceral organs with deficiency of both qi and blood. The latter is common in diseases of the heart. Here we see the analysis of a choppy pulse. There are two factors to contribute to the formation of the hesitant pulse. One is impedance of blood circulation due to qi stagnation, blood stasis, turbid phlegm, accumulation, or food retention. The impedance of blood circulation leads to a slow or at best even rate with intervals without beats. The other factor is deficiency of qi and blood due to visceral insufficiency, and this condition also leads to impedance of blood circulation, hence a hesitant pulse. A pulse which feels thin, minute and short, and has an uneven flow, beating 3 and 5 times with irregular rhythm is called choppy. It feels like a knife scraping bamboo, rough and jagged. It is easily scattered like rain falling onto the sand. It also moves very slowly and at irregular depths, like an ill silkworm eating a leaf. The choppy pulse must not be confused with a scattered intermittent or minute pulses. The choppy pulse has a root, and although it seems to scatter, it does not. This is the primary differentiation from scattered pulse. The choppy pulse does not stop periodically, unlike the intermittent pulse. The choppy pulse can be clearly felt at the floating and deep levels, unlike the minute pulse. The choppy pulse usually results with a deficiency of the yin blood with damaged jin yi. It therefore occurs in severe stomach obstruction or even when severe sweating damages the yin and yang. It also manifests when cold, damp, perverse qi penetrates to the yin level, causing blockage and stagnation of blood circulation. A choppy pulse in pregnancy means that the woman has insufficient blood or nourish the fetus. A choppy pulse in a non-pregnant woman means the jing and blood are drying up and it would be difficult for her to conceive. The kun, the guan and the chi. The kun position becomes choppy when damaged heart blood causes chest pain. The guan position becomes choppy in weakness and deficiency of the spleen and stomach, where chi stagnation at both sides of the rib cage causes fullness and swelling. The chi position becomes choppy when damage to the jing and blood in the lower heater results in knotting in the intestines, causing constipation and dribbling of urine or intestinal wind, causing bleeding. Thank you for your attention.
Let's discuss liver blood deficiency. The liver has a very close relationship with blood. Liver qi helps to ensure that there is free movement of blood in the body, and it is in the liver that blood is stored. The liver constantly ensures that the correct amount of blood is circulating in the body at any given time. During physical activity, blood is sent out into the body, and when the body is resting, blood returns to the liver. At night, blood is mainly gathered in the liver, where it helps to anchor the hun. Blood, for its part, helps to nourish and moisten the liver. Therefore, it is essential that there is sufficient liver blood to keep the liver soft and flexible. Otherwise, liver qi will have a tendency to stagnate. Liver blood is an aspect of liver yin, so there will be an overlap of symptoms and signs between these two patterns, but there are also important differences. Due to menstruation and childbirth, women have a greater tendency to be liver blood deficient than men. There are three main causes of liver blood deficiency: poor production of blood, insufficient consumption of food that nourishes blood, and loss of blood through bleeding. Excessive physical training can also consume blood, meaning that blood deficiency arises. Blood loss during childbirth, heavy menstrual bleeding, bleeding disorders, operations, physical trauma, and so on can lead to liver blood deficiency. The condition can still be present a long time after the blood loss. In some cases, this can be years later. Excessive physical activity, especially in women who train hard, can lead to liver blood deficiency. This does not only affect professional sportswomen or dancers, but can also affect women who train to run marathons, triathlons, or Ironman events because the excessive training consumes blood, which is used to nourish the muscles. This is why many women who play sport, dance, and train at a high level stop menstruating. Poor production of blood will be due to weakness of the organs involved in blood production. This will be due to etiological factors that weaken the spleen and kidneys and will eventually lead to liver blood deficiency. Even if the spleen and kidneys are strong enough, liver blood deficiency can still arise if the person's diet is deficient in foods that directly nourish blood. Symptoms and signs: dizziness, especially when getting up from a seated or lying position, spots or floaters in the vision, difficulty focusing the vision, dry eyes or a sensation of grit in the eyes that water in the wind, sensitivity to bright light, poor night vision, insomnia, pale and sallow complexion, pale and dry lips, dry skin, rigid fingernails or weak and frayed fingernails, dry hair, hair loss, numbness or tingling in the limbs, weak muscles, leg cramps or restless legs, especially in the evening and at night, amenorrhea or scanty menstrual bleeding, depression, sadness or lack of vision in life, tendency to be weepy and very sensitive during the premenstrual phase, indecisiveness. The voice may lack resonance and be hesitant. The voice may lack resonance even when they are angry. Thin, pale, and dry tongue, pale or orange sides of the tongue, fine or choppy pulse. Key symptoms: dizziness, floaters in the vision, scanty menstrual bleeding, rigid or weak fingernails, and pale sides of the tongue. Treatment principle: nourish liver blood. We can choose from bladder 17, 18, 20, 21, stomach 36, spleen 6, liver 3, 8, and ren 4. Needle technique is tonifying. Moxa can be used and should be used on bladder 17. Bladder 17 nourishes blood. Liver 3, liver 8, spleen 6, and bladder 18 nourish liver blood. Spleen 6, stomach 36, bladder 20 and 21 tonify spleen chi and thereby the production of blood. Ren 4 tonifies yuan chi and thereby the production of blood. It is important that a person who is liver blood deficient eats a diet that nourishes blood. They will benefit from eating red meat, bone marrow, and blood sausages. Eating organic liver will be especially salutary because it nourishes both blood and the liver directly. Green leaf vegetables will also be beneficial because they have a high iron content and because their green color has a resonance with the liver. Other foods that nourish blood are beetroot, seaweed, dates, kidney beans, black beans, aduki beans, goji berries, angelica, and nettle tea. A person who is liver blood deficient should avoid sugar, stimulants such as coffee, and too much alcohol. The patient should eat a diet that not only directly nourishes liver blood, but also tonifies spleen chi, that is, warm prepared food that is not cold in its energy and does not produce dampness. Lying down for 20 minutes in the middle of the day is recommended as it enables blood to return to the liver. Excessive training should be discouraged. Liver blood deficiency can be caused by blood deficiency, spleen chi deficiency, spleen yang deficiency, kidney yin deficiency, and can result in spleen chi deficiency, liver chi stagnation, heart blood deficiency, liver yin deficiency, ascending liver yang, kidney jing deficiency. Let us summarize liver blood deficiency. Etiology, diet poor in nourishment or lacking in protein, damage to yin blood as a result of prolonged illness, blood loss, excessive physical work, chronic illness, too much sexual activity. Underlying accompanying pathology, stagnation of liver qi, spleen qi deficiency, kidney yin deficiency, liver yin deficiency. Signs and symptoms, dizziness, numbness, tingling of limbs, insomnia, blurred vision, visual floaters, poor night vision, light menstruation, dull pale complexion, pale lips, muscular weakness, cramps, brittle nails, dry skin, hair, depression. Pulse choppy or fine. Tongue, pale body, paler sides. Sides may be orangey. Treatment principle, nourish young, rectify blood. Acupuncture treatment. Bladder 18 nourishes liver blood. Bladder 20 fortifies spleen to generate blood. Bladder 17 with moxa nourishes blood. Liver 8 supplements liver blood. Liver 14 calms the liver. This inhibits qi. Liver 3 courses liver qi. Spleen 6 nourishes blood. Ren 4 supplements blood. We do moxa. Stomach 36 supplements blood. GB 34 nourishes the sinews. Bladder 23 enriches kidneys to generate blood. The extra point Yu Yao benefits the eyes and needle with supplementation. Thank you for listening.
Let's talk about skin inspection, chickenpox, miliaria, spider angioma, and scaling. Chickenpox. Chickenpox is also an acute contagious illness. It is due to seasonal exogenous wind heat attacking the lung and expressing in the skin. Typically, the rash of chickenpox first erupts on the trunk, shoulders, and armpits before spreading to the proximal areas of the limbs. When they first appear, the pox look like red papules. They soon transform into transparent crystal-like vesicles with a red color and may become cloudy. When the vesicles turn dry, they leave a scab that eventually falls off, leaving no scar. That is the illustration of the chickenpox. Miliaria. Miliaria is also known as prickly heat. Is caused by dampness heat, which induce profuse sweating and sometimes retention of sweat in the sweat pores. The skin rash looks like a field or crystalline vesicles the size of millet seeds. The vesicles have thin walls that rupture readily. If undisturbed, the vesicles will dry and desquamate. The rash is most prevalent on the chest, but can appear also on the neck and the trunk. That's the illustration of the miliary. Spider angioma. The spider angioma is a lesion that consists of a central red dot with radiating red arms, resembling a slender spider. Pressure in the central dot causes blanching. It occurs mostly on the face, the neck, the hands, the arms, the chest, and the shoulders. Spider angiomas are caused by impedance of blood and fluid circulation with blockage of vessels. Their presence suggests liver disease such as hepatitis and cirrhosis. However, a few spider angiomas may also be seen in healthy persons and pregnant women. In such persons, they have no clinical significance. The illustration of the spider angioma. Scaling. Scaling refers to local or extensive dryness and roughness of the skin, which result in lesions that are like fish scales and rough to the touch. There are several varieties of scaling. Dry scales are usually due to insufficiency of blood, with wind dryness causing the skin to lose its nourishment. Greasy scales are mostly due to dampness and heat. If injury to the skin extends more deeply, with large patches of scaling tightly attached to underlying dark red macules, the cause is usually blood stasis in the interior. If the affected skin is bright red, the overlying scales are fine like chaff or large like deciduous leaves, and there is itch or pain or a burning sensation. The cause is mostly accumulation of cold and dampness, blocking the meridians and congealing chi and blood. Illustration of the scaling. Thank you for your attention. Now let's talk about erectile dysfunction, the Western medicine concept. Erectile dysfunction. Erectile dysfunction, sometimes called impotence, is the repeated inability to get or keep an erection firm enough for sexual intercourse. Erectile dysfunction, or ED, can be total inability to achieve erection, an inconsistent ability to do so, or a tendency to sustain only brief erections. These variations make defining ED and estimating its incidence difficult. In older men, ED usually has a physical cause, such as disease, injury, or side effects of drugs. Any disorder that causes injury to the nerves or impairs blood flow in the penis has the potential to cause ED. The incidence of ED increases with age. However, ED is not an inevitable part of aging. The penis contains two chambers called the corpora cavernosa, which run the length of the organ. A spongy tissue fills the chambers. The corpora cavernosa are surrounded by a membrane called the tunica albuginea. The spongy tissues contain smooth muscles, fibrous tissues, spaces, veins, and arteries. The urethra, which is the channel for urine and ejaculate, runs along the underside of the corpora cavernosa and is surrounded by the corpus spongiosum. Erection begins with a sensory of mental stimulation, or both. Impulses from the brain and local nerves cause the muscles of the corpora cavernosa to relax, allowing blood to flow in and fill the spaces. The blood creates pressure in the corpora cavernosa, making the penis expand. The tunica albuginea helps trap the blood in the corpora cavernosa, thereby sustaining erection. When muscles in the penis contract to stop the inflow of blood and open outflow channel, erection is reversed. Since an erection requires a precise sequence of events, ED can occur when any of the events are disrupted. The sequence includes nerve impulses in the brain, spinal column, and area around the penis, and response in muscles, fibrous tissues, veins, and arteries in and near the corpora cavernosa. Damage to the nerves, arteries, smooth muscles, and fibrous tissues, often as a result of disease, is the most common cause of ED. Diseases such as diabetes, kidney disease, chronic alcoholism, multiple sclerosis, atherosclerosis, vascular disease, and neurological disease can lead to ED. The same life habits that contribute to heart disease and vascular problems also raise the risk of ED. Smoking, being overweight, and avoiding exercise are possible causes of erectile dysfunction. Surgery, especially radical prostate and bladder surgery for cancer, can injure nerves and arteries near the penis, causing erectile dysfunction. Injury to the penis, spinal cord, prostate, bladder, and pelvis can lead to ED by harming nerves, smooth muscles, arteries, and fibrous tissues of the corpora cavernosa. In addition, many common medicines such as blood pressure drugs, antihistamines, antidepressants, tranquilizers, appetite suppressants, and cimetidine can produce ED as a side effect. Experts believe that psychological factors such as stress, anxiety, guilt, depression, low esteem, and fear of sexual failure can lead to erectile dysfunction. Other possible causes are smoking, which affects blood flow in veins and arteries, and hormonal abnormalities such as not enough testosterone. The summary for erectile dysfunction. Erectile dysfunction is the repeated inability to get or keep an erection firm enough for sexual intercourse. In older men, erectile dysfunction usually has a physical cause such as disease, injury, or side effects of drugs. Erection begins with a sensory or mental stimulation, or both. Impulses from the brain and local nerves cause the muscles of the corpora cavernosa to relax, allowing blood to flow in and fill the spaces. The blood creates pressure in the corpora cavernosa, making the penis expand. The tunica albuginea helps trap the blood in the corpora cavernosa, thereby sustaining erection. When muscles in the penis contract to stop the inflow of blood and open outflow channels, erection is reversed. Damage to nerves, arteries, smooth muscles, and fibrous tissues, often as a result of disease, is the most common cause of erectile dysfunction. Diseases such as diabetes, kidney disease, chronic alcoholism, multiple sclerosis, atherosclerosis, vascular disease, and neurological disease can lead to erectile dysfunction. Smoking, being overweight, and avoiding exercise are possible causes of erectile dysfunction. Surgery, especially radical prostate and bladder surgery for cancer, can injure nerves and arteries near the penis, causing erectile dysfunction. Injury to the penis, spinal cord, prostate, bladder, and pelvis can lead to erectile dysfunction by harming nerves, smooth muscles, arteries, and fibrous tissues of the corpora cavernosa. Blood pressure drugs, antihistamines, antidepressants, tranquilizers, appetite suppressants, and cimetidine can produce erectile dysfunction as a side effect. Psychological factors such as stress, anxiety, guilt, depression, low self-esteem, and fear of sexual failure can lead to erectile dysfunction. Thank you for your attention.